Hi there. This is Marielle Conception, your host of the My DPC Story podcast. Have you or someone you care about ever been burned by the U.S. healthcare system? If so, you are listening to the right video, because if you are listening, chances are the answer is yes. But the U.S. spends so much on healthcare. Why are so many Americans affected personally and especially financially by the healthcare system? Shouldn't that mean we have better healthcare access and treatment options? Shouldn't it be easy for us to be able to see our doctor when we need to instead of turning to the ER or urgent care? Historically, it's been seemingly impossible to answer these questions. But now that is changing through the direct primary care movement. This video that you have tuned into will bring you into the world of direct primary care and show you how physicians all over the country are changing the way they practice so patients from all backgrounds get the high quality care they need and deserve, which makes for both happy patients and physicians. Learn even more by subscribing to the My DPC Story YouTube channel. Find us on all major podcast platforms. Find us on socials at My DPC Story and at mydpcstory.com. There you can find resources including how to find a DPC doctor near you, conferences about DPC, DPC startup guides and advice, a store with DPC swag, and even a mapper showing where podcast guests are practicing. Thanks for tuning in to hear about this powerful movement. Now, on to the episode. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Conception, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
DPC, to me, was the opportunity for myself to become a better physician to my patients and also a better individual and father to my family and my friends. And it gave me the opportunity to practice medicine the way I wanted to, on my terms and on my conditions. And it's one hell of a story, and I can't wait to tell it. I'm Dr. Anand Mehta, and this is my DPC story.
Dr. Anand Mehta is a dedicated board-certified family physician who has focused on patient care and improving the patient experience throughout his medical career. He was born and raised in Buffalo, New York, where he attended SUNY Buffalo, and then he later graduated medical school from Kasturba Medical College in Manipal, India. His residency was completed at Hunterton Medical Center in Flemington, New Jersey, where he continued to work for the hospital system there for 4 years. After the move to Georgia, Dr. Mehta worked as a solo family physician for Wellstar Health System for 5 years in Roswell, Georgia, where he later established himself as the medical director for primary care for the local hospital. He then took a position as the first medical director in the nation for Walmart Health during the summer of 2019. He helped grow the pilot location into a successful model that promoted the growth of future Walmart centers in Georgia and beyond. However, he left this position to pursue healthcare that meant more of a difference in patients' lives than his personal wallet. Dr. Mehta takes the time to listen to the needs of his patients. He is an extrovert known to make people laugh, is empathetic, kind, and welcoming. His character is spoken highly of by his patients both in New Jersey and in Georgia. He has received remarkable patient satisfaction scores coupled with providing exceptional care to his patients. Dr. Mehta is a doting husband and busy father to 3 young children. When he is not busy with family life, he has been seen around Atlanta doing stand-up comedy, playing basketball, or watching the Buffalo Bills. He is a better physician and person since starting stand-up family medicine in 2020. Welcome to the podcast, Dr. Mehta.
Thanks, Marielle. Great to be here. Thanks so much.
Now, it's my pleasure to talk with you yet again because I consider you a dear DPC world friend, but you and I were on a panel just yesterday at the DPC 2021 Summit. So I wanted to start off with your background because For those of you who may or may not know, Dr. Mehta was the first medical director for Walmart Health and had also previously been approached by Diamond Physicians as well as in his own private practice prior to opening Stand Up Family Medicine. Dr. Mehta, I'm wondering if you can please share with us more about that amazing background that you came from.
So my background is interesting. I actually went to medical school in Manipal, India, and it was an interesting journey getting there. I was in University of Buffalo, and I was actually studying to be an actor. And I thought I had a gift being a stand-up comic. My father and mother, who were also physicians, did not think I was too funny and thought it was a better idea for me to go to med school. So they actually filled out an application, and I got into that school. And before you knew it, instead of going to junior year at University of Buffalo, I became a medical student in Kasturba Medical College in India. So I graduated from there. I came back. I took my USMLEs, and I got into a residency program in Heart and Family Medicine residency in Flemington, New Jersey. I did my residency, graduated, and took a job with the hospital at a place called Heart and Family Medicine. It was a 2-provider practice that had a 70-year-old physician who was about to retire and a middle-aged physician who was also a former graduate of the same residency program who was aligned to be my mentor. However, the day I joined, I realized that they were not on good terms. And that mentor, who was the physician I was supposed to work with, gave us 2-week notice. And so basically in 2 weeks, I inherited a 4,500 patient practice and had to dive into it head first, very scared, like a deer in the headlights. There was a nurse that I'm still very good friends with now named Joanne. She looked at me, settled me down and said, "Hey, we can do this. I have a son who's getting into college and I need this job. We're just going to have to make it work." So at that point, reality hit the hard way, but it was a good team. And she did help me along the way and told me how to handle certain patients differently and told me whatever she knew about the patients. And we did it. The 70-year-old physician was nice enough not to retire, but he came in a couple of days. He mentored me with a couple of questions I had, and I started running a solo practice basically right out of residency. And it was a big eye opener, but what was really good in a way is that it really gave me the sense of how unique a practice is as an individual physician and the relationship that you have with your patients. I think it was one of a kind, and it got me on my feet and discovered, not necessarily the hard way, but in a good way, how important a family is, not only with your coworkers, but the patients that you have and that trusted you with their care, despite knowing that you were just a kid out of residency. So we did that for about 2 years, and then hospital mergers took place and they shifted 2 practices together, and we became Cornerstone Family Practice, which was a 7-provider practice. That was a big shift for me because I realized being in a multi-provider practice was difficult, and patient care was not as coordinated as being an individual practitioner. I saw working with mid-levels as well as other MDs that patient charts were getting mixed up. Care was being broken. The simple things like med refill requests were being confused, and it was just difficult to get things done. But we stayed with it. I also was fortunate to meet my future wife and was engaged and later got married. And when it was time to look for a house, New Jersey taxes became evident. And I thought it was a good time to ask my hospital for a raise. I got a raise request of $5,000, which at that time wasn't going to cut it, but also was a slap in the face to realize that no matter what you did for the hospital and how many years you served for them, which was 7 in total, including residency, it didn't matter because your patient satisfaction scores, you're recognized by your colleagues and your specialists, the familiarity and the good things that your patients said about you. At the end of the day, you're just a number. And they gave me a number back that just wasn't going to make me feel right. So at that time, I looked at my wife. I said, we're going to have to look for something different. I chose Atlanta, Georgia as the next place to move, particularly because my sister is in Greenville, South Carolina. She's an oncologist. She kept enforcing and reiterating that the South is a better place to live. The cost of living is better. And Atlanta seemed a good hub that was diverse and that seemed to have a lot of good opportunity at the time. And so I took a job with North Fulton Primary Care. They built a solo practice around me. And the CEO at that time had just a good feeling about me, and I had a good feeling about her. And it gave me the opportunity to start a practice brand new. So came to Atlanta not knowing anything, not knowing anybody in the area, any of the patients. And I just started becoming hungry to make this practice successful and doing things that most physicians wouldn't do. I would go to the neighborhood pools and dress in a swimsuit and bring some cards with me and tell them that I was looking for a house in the area. And I was wondering if they had primary care that they were using, and got into conversations about what I did and started spreading cards around. And before you knew it, the practice started growing. I had a medical assistant. Her name is Andrea, who's also actually the medical assistant I have at my current DPC practice. And I'll get into that for a second, a little later. But it was a good story coming to Atlanta in the way that you saw the practice grow around you. I had a good relationship with the hospital CEO at that time, as well as a lot of the supporting staff. I felt a very good community around me. But like most hospitals, things get bought out and different mergers happen. And when the hospital later got bought by Wellstar, the pieces at the round table changed, the management team changed, and then the office would change. And also the staffing and bringing on other providers, that also eventually happened. And unfortunately, when things change around you, you don't really dictate those changes. You have to just incorporate them as part of your new lifestyle. And that was difficult for me to just go happens that I attended a DPC summit back in 2018, right when sort of all these changes were taking place. And I was really interested in the DPC concept at that time. I actually was approached by Diamond Physicians as they were attempting to franchise out into the Atlanta area, and went really far with the negotiations there and really was about to make the leap. Unfortunately, financials didn't fall through exactly as planned. And I stayed at the existing Wellstar clinic that I was at. Then fast forward to a year later, which would be 2019, early 2019, I was approached with an opportunity to become the director of Walmart Health's first location in the country out in Dallas, Georgia. There were two executives who talked to me, and they wanted to have a healthcare venture that would incorporate a price transparent, cost effective, and open clinic that would incorporate not only medical, but dental, hearing, optical, pharmacy, mental health, all in one. I thought it was a great concept, as I knew that primary care was lacking almost everywhere, but a lot in that Dallas, Georgia area. I also thought that the price transparent model was in a way similar to direct primary care, but I thought on a bigger scope that maybe I could help mold it into something that could be scalable and that it could be successful. And so I took the opportunity, fully stating the truth behind it. There was a lot of things on that table that they gave me the opportunity to grow with. But unfortunately, when I did join and that the job took place, there's a lot of other people making decisions. And I think an easy way is say they were more interested in the growth of something versus the actual running of it and how it would function and how we could make it a good model that could be a success in primary care moving forward. Their aspirations and their vision was not aligned with mine. And we decided to part ways in August of 2020. However, that was the step I needed to make in order to have the courage and the commitment to do direct primary care. We all go into certain situations where we get pushed and we get pushed and we get pushed, and you have your fist clenched and your heart is pumping and the adrenaline is going. But we just find a way to calm down and continue putting our heads down and getting back on that hamster wheel. That was enough for me. I just got tired of being pushed around. I got tired of people telling me how to do medicine the way I knew it was supposed to do. And I felt like there's only one way to do it. And it actually came into a phone call with that leadership with Walmart Health and said, Dr. Mehta, you sure complain a lot about how we do things. If you think you can do it better, why don't you do it yourself? And that was it. I said, you know what? That's exactly what I'm going to do. And it was at that time I hung up the phone and I told my wife, I'm going to do this direct primary care, and I'm going to do a clinic my way, and I'm going to do it the way I always wanted to. And that's when I created Stand Up Family Medicine. And currently it's doing great. We opened in October 2020, and we're at 225 patients as of mid-July. And so we're up and running, and the story continues, and it continues to be a good one.
It's just incredible. I hear your story, and the way I visualize it as I'm listening to you is literally you have fought your way to where you are today, and you are standing up for yourself, your medicine, and your patients with every step that you've taken along your journey. I mean, even going to medical school when you thought you were going to be a junior in college in the States, to being thrown into a clinic that you did not expect to, with over 4,000 patients, and then going to different models of merging clinics with corporations, and then to one of the biggest corporations out there.
Yeah.
You literally have fought your way to where you are, and now you're taking care of over 220 patients. That is incredible. What an incredible story.
Yeah, not exactly how I would write it if I had to do it again, but it's the way it had to be written in my book of life in order to talk about it today and to make it even more of a dream come true. And I think back in the day when I was first starting out in residency, I wanted to be successful. I felt that I had a good opportunity and a good way of talking to people. I like communication. I like being social. I like being the voice in the room. I like making people laugh. I don't mind being the center of attention. I don't mind having the table around me and cracking jokes. But I also felt I had something special to offer people. And you get in this system and you start chugging away, and you start thinking that the more patients I see, the more successful I'm going to be. But the problem with that is the more patients we see, the less time we have for them, and the less successful we actually are as individual physicians, as well as individual people, because we're just doing whatever we can to rush through the schedule. We're always thinking about the next two patients after that person that you're talking to. And we always think about the next step in our career. What can I get to, And I climbed that ladder. 10 years out of residency, I climbed to a director position at a Fortune 1 company. And you would look around you and you would say, this is it, Dr. Mehta, you got it, you made it. But what you don't see on the other side of that is someone who was depressed, who was miserable in his job, who was fighting with people who didn't understand healthcare, with seeing patients and not feeling good about what you did at the end of the day. Not because of your care necessarily that you're providing them, just because of the culture you were in and the surrounding you were in and the inability to make change. And when you get trapped in those walls, sure, a title is great and it means a lot on a piece of paper, but as a person, you go home and you're not the same person. You're not the same person that you want people around, that you made people laugh. You become very sad and lonely, and you get mad and angry and irritable, and change as a father, you change as a husband, and you just change as a person, what makes you who you are. And I only see this now because I'm back to the person I was before, and I realize how much I've changed over these years, especially the last year that I was with Walmart Health and had to go through that. But you also realize how free and independent you are, and how happy you are. Yes, I know I'm not making the same check I had with Walmart Health, but I'm okay with that. Yeah, some days are hard and some patients take a little longer, but that's what you do it for. And I used to dread having to work and do a 45-hour commute to Dallas, Georgia to work at Walmart Health. I hated even the fee-for-service world with the hospital, looking at my schedule and dreading trying to get to 3:30 or 4 o'clock and how many notes I had to finish at the end of the day, and when I would have time, or not being able to do a lot of the things that I wanted to do for my kids, with my kids, or with my wife because of the time constraints with my schedule. That changes. You change. And you don't know how you change because it's a process that happens slowly over time and just changes you and beats into you year after year. And then you break free of it. You break free of the shackles that fee-for-service and that corporate world does for you. You realize that you're not crazy for feeling that way, and you start finding your smile again. You start laughing. You start enjoying your patients, and the patients enjoy you back. You get slaps on the back, and you give them hugs back because you have a great experience and a great time with them, and you enjoy seeing them. And that is bigger than any paycheck. That is bigger than any name on a resume. That is your happiness. That is your growth, and that is why I did what I did, and I don't regret it. And I feel more confident each month that goes into it, and each patient that joins. It makes me more happy that I made the choice that I did, And I just believe in myself more. And I bet on myself more because that's it. You literally are the brand. And Walmart and Wellstar or whatever hospital system you work at, it's just a name behind you. You're who they're going to see, not the name behind it. And sometimes it took a long time to understand that. But that's what I'm trying to tell other people, young in their career, residents, med students, you name it. You don't have to be a name on a piece of paper, on a resume to make yourself feel good. You have to feel good about what you do. And when you do, you'll never look back.
Stay with us. We'll be right back. My DPC Story just hit 100,000 downloads on Apple Podcasts alone, and we could not have done it without our amazing listeners. So to thank you and to celebrate this milestone, we're giving away an incredible DPC Summit prize package for the DPC Summit happening in Minneapolis this summer. The prize includes My DPC Story swag, and on top of that, the prize also includes a ticket to the DPC Summit. Check out my interview with Dr. Jeff Davenport, where you'll hear more details about the summit. To be eligible for this giveaway, all you have to do is first rate and review My DPC Story on your podcast listening platform. Pro tip, if you rate My DPC Story with a 5-star review, it helps the visibility of the podcast and it helps others to find all these DPC stories. Number 2, take a screenshot of your review and email it to support@mydpcstory.com. You'll find that email in the show notes as well. And third, make sure you're following My DPC Story on all your social media platforms: Instagram, Facebook, TikTok, YouTube, LinkedIn, and Twitter. All the social links are at the bottom of mydpcstory.com and also in our show notes. For bonus points, share both this episode and the My DPC Story posts about the DPC Summit with your community. The winner will be announced in a future episode, so make sure you tune in to find out if you'll be heading to the summit. If you've already purchased your ticket and you're the winner, My DPC Story will send you a check for the price of your ticket. Thank you for listening to My DPC Story, and best of luck. When you decided to go into DPC, when you decided to open up your own clinic, I want to ask first about the name, because Stand-Up Family Medicine, clearly you have stood up for yourself. You, again, like I said, you fought your way to where you are today, and you just explained you're a better person for it. But I want to ask, how did you come to that name specifically? And when you talk about these other brands that they're behind you, now you are your own brand. You are your own clinic. Right. And how did you choose a name that represented you as a doctor and as a person and as a person who cares about other people for a living?
So it took a while. I took a good 8 names before my wife didn't roll her eyes at me. I thought of everything from Meta and Meta Primary Care to Meta's number 1 to finally just ending up at stand-up. And stand-up has name. One, obviously, stand-up is because I do stand-up comedy. I did it ever since, my father never thought I was funny. I wanted to prove him wrong. So once I got into residency, he had nothing holding me back and he wasn't going to send me to India again. So I thought this is the time to fly with it. So I started doing stand-up in residency, and I ended up having a lot more fun than I thought I would doing it. And so there's an element of where stand-up comes from. The other thing is when I joined Walmart Health, I did have videos, and I still do have videos on YouTube. But when I started, they wanted me to delete them. They said, this is not the image we want as a director who's going to be the head of our pilot facility. And at the time, I didn't know any better. I said, this is what the change and the culture demands. I'm going to change along with it. So I took them all down. And after I gave my notice of resignation, I put them back up. So there's a reason I said stand up, because I wanted to stand up for what I believed in. I wanted to stand up for primary care. I wanted to stand up for better physician wellness. And I wanted to stand up to that culture. I wanted to stand up and say, you know what? I'm going to do exactly what I want to do on my terms, the way I want to do it, and be myself. And so stand-up has not only a meaning because of the personality behind it. I think stand-up has a meaning because of what we're all trying to do. And it's stand up for what we believe in, and stand up for what we want our patients to believe in, and for what we think primary care should be about. So that's why I like stand-up. That's why stand-up's here to stay. And that's why stand-up is growing as we speak.
Awesome. In your clinic right now, it's you and Andrea. Can you share about how she decided to come on board with you as you opened up stand-up?
Yeah, I know every DPC clinic does things differently, and everything is about keeping overhead low and bringing on members to your team when the need desires. But Andrea was a medical assistant who started with way back in 2014 when I first moved to Atlanta, Georgia, and took that position and started that solo clinic. She was working with a provider at that time who she was unhappy with. And she came up to me and said, "Hey, I'm Andrea. I'm a medical assistant, and I would like to work with you." And I said, "No, I don't know anything about the area, and I don't know any patients or anything. And I don't know why you're leaving your existing provider." And she said, "I just want somebody I can communicate with and be open and honest with, and that treats me like a person." And I said, "Yeah, sign right here." And so she was my medical assistant for 5 years, all along the whole journey with North Fulton Primary Care and then moving into Wellstar. My patients loved her. I love her. And I think the world of her. And I know she does the same back at me. And she was a great teammate and a great coworker. And so when I did give my notice with Walmart, I had a year outside of Wellstar at that point. And so there was nothing holding me back from approaching her and asking her to join my team and my dream, which was stand-up family medicine. And so I took her and her husband out to dinner with me and my wife. And I said, "Okay," I said, "this is what I want to do. I want to start a direct primary care clinic. This is how it works. This is the model and how it's going to function. And I can't offer you a crazy salary right away. I can't offer you any of the benefits the hospitals give you. I can't give you a 401. I can't even give you a life insurance policy. But I will offer you all the success I have moving forward if we do become successful." And she looked at me and she said, "Tell me where I sign." And I didn't have a contract made. I didn't have an office location. I didn't have office furniture. I had a dream and I had a name behind the dream. And I knew I needed somebody that I could trust and build it with because I just felt more confident as a team versus an individual. And so we started day one, and she's been with me ever since. And a lot of the patients who were older patients of mine love hearing her voice when she answers the phone. And happy that we're a team again, working together and taking care of things. And we work well together. You know, good work is hard to find. And I think a lot of people looking for MAs or assistants of any sort can agree with me. If you have someone who really commits to what your personality is and what your patient care experience should be, then that speaks for you and that speaks for your practice. And when they walk in and see her, they love it. And I love them being able to see her. If I'm away from the office, let's say on vacation or out of town, I can trust her to be at the office and still run smoothly. And for messages that need to get to me. It's just having a good relationship and a good teammate that makes you even more successful and helps you grow faster. And I bet on myself. I knew that I was going to be in the hole initially, but I felt that with her on board, I could build the practice quicker. And I felt that it was two people answering the phone versus one. And I felt like we could have two voices that speak out to other businesses or other clients or other neighbors, or the list goes on. And two is always better than one sometimes when you're trying to expand. And so I'm glad that paid off. I'm in the black, and she's being paid off of patient collections that we're getting from memberships. And so it was a bet that I never regret. And I feel great as a business entrepreneur that I did. And we continue to grow and make this team work together. And it's a great story when it comes together. But initially at the time, she was willing, and that speaks a lot. She was willing to drop everything from a stable job with the hospital system that had her covered in so many ways to work with a physician that she believed in and she trusted that it was going to make it work. And so I didn't want to let her down, and I didn't want to let my family down. And it was a great story. And she's the voice that you'll always hear and that will smile at you right when you come into clinic every day.
For those of you who haven't seen it, Dr. Mehta's standing in front of his stand-up family medicine sign. And I remember the day that he posted that on Facebook and the day that he said, "Look, this is me. This is my logo." He's even got a ventriloquist puppet. He's got it all going on. And I want to ask you, those first days when you were opening, when you started off with 0 patients, what was that experience like for you, being in your space and coming up with what do you have to say to a patient who's actually interested in your practice? Did you have any deer in headlights sort of reaction, or did you have it oiled down?
I was scared is just an easy way to say it. I was lost. I remember getting the phone lines set up and having an office number and starting to spread the word about it. And the first phone call came in, and I had Andrea, the medical assistant. I said, okay, now just watch my lead and you're just going to follow along. And she said, okay. And so she had her notebook out and she's like, okay, go. And so I picked up the phone and I said, hey, this is Dr. Anand, Dr. Mehta here. And this is a direct primary care. This is a clinic that we don't take insurance. We're membership. We're 80. How old are you? It's 89. Okay. Do you have insurance? Who do you see currently? And I didn't really even let that person talk. My medical assistant was trying to keep it together. She didn't last very long. And the patient hung up. And I would have hung up a long time ago too. But it was a disorganized mess. It was a disgrace. But it was not the elevator pitch I had in mind. And I hung up the phone and I felt frustrated, embarrassed, you name it. And she looked at me and she's like, I'll get the next one. I said, yeah. I said, that sounds pretty good. So she did a lot better than I did. And we just got better with each phone call that came in. And I think we've pretty much mastered it now. And once you do it and once you practice it and the wheels get moving and the office environment takes place and the office day goes on and you get that initial adrenaline rush out, you just become better at what you do. And all we ever wanted to do is be good physicians and be social and be there for our patients. And when you practice in that environment and you get better at doing it and you just become more natural at doing it, those things like the elevator pitch and how you talk about your practice, you just have more confidence behind your voice. You feel good about it. You have a product that sells and you believe in what you're selling. And it's your niche. I always think that your niche is what makes you unique and special. And I tell people our niche is that we love serving our patients and we love doing it well and we take pride in it. And we have a good time here. We'll have good laughs. And if it's really good laugh, it goes up in the stand-up show. If it's not, don't worry. We'll still laugh about it. We'll still have a good time. Nothing's rushed. And word of mouth gets around. And so the elevator pitch doesn't really need to take that much effect. They're happy to talk to the doctor sometimes when you pick up the phone. They're happy to hear a voice that they're familiar with when Andrea picks up the phone sometimes, if it was an existing patient. And they're just happy about what other people told us. Told them, about our practice. And they're just excited to be part of it. And so we used to have meet and greets, and we used to set up about half an hour to talk about our practice and give them a tour and explain how it works. We don't even need to do those anymore. A lot of the people who are coming to us are just friends of friends who heard about us and said, no, I know everything I need to know. So-and-so told me they love you and they love Andrea and they love the experience they got. My wife, Maria, she's also helping out in the practice. So they also bring her name up. And the good thing about growing is that you can grow. And since it's a family business, you can bring your family into it. And I think there's more of a traditional experience that way. You know, when someone can come in and be familiar with who they talk to and the personalities that incorporate your team, they become more of a family and more community. And we just feel better about what we do because of it.
With this idea that you're selling the brand and you're selling this amazing way to practice healthcare. And yes, I am very biased when I say that, but it is the best way. I just think about when people talk about DPC, I feel like I'm talking to people about their child, like that their child achieved some amazing achievement in their life and they're so proud to talk about it. And it's so different. I've never talked with a physician who is a fee-for-service physician or a corporate physician who is giddy when they talk about, guess what I did today? Yeah. Guess what I can do because I say I can do it. And I don't have to have any administrator approve it. I don't have to go through a committee of people who don't even practice medicine tell me yes or no. It's just amazing. And that Kool-Aid, that DPC Kool-Aid is a legit thing. And it's so interesting that everybody has their own way of finding the movement. But clearly, you know, you are getting the word out because of what you guys do.
Yeah. Yeah. I have patient experiences that have surpassed what I've done in 10 years in just a little amount of time we've been open. I have patients who own a reptile store that will bring in a bearded dragon so I can see it just because I asked questions about it last visit. I have hugs that really mean hugs where they'll cry on my shoulder because of the good experience that they had or not good experience that they had because they mean it and they believe in you and they want to talk to you about it and they feel comfort when you talk to them about it. I have laughs that go on for days. I have patients sending me stand-up clips of people that I've never heard of. These are things that no fee-for-service world can replicate. They can't. These are true patient encounters. And I know that other direct primary care doctors who have done your show or who haven't done your show will agree with me. I think that these genuine relationships that you form with your patients are just freaking awesome. They're just amazing. And you don't need to be a director to experience it. You don't need to climb to the top of the corporate ladder in order to find success. Your success is your brand. Every DPC clinic is individual for that brand and that personality that brings with it. And you sell it just by the person you are, just by being a genuine person, because we are all genuine people. We all have our own personalities and we just could never express ourselves because we'd be too rushed or out of time, or thinking about the next 3 patients, or having a chart into the middle of the night. And we'd just be living these miserable hamster wheel lives that we wouldn't enjoy the relationships and the friendships that we have with our patients as much as we do now. Yeah, it is unique. Direct primary care, you'll hear as many podcasts like you'd have, and you'll keep telling yourself, this is it. This has got to be it. This is it. I was listening just like all of you to summits and to panels, and it was just great being able to speak on one. I thought it was the coolest thing that I would be in this audience 2 years ago and looking at that panel and thinking how awesome these doctors sound and look and what their stories are, and admiring just the background behind them. And it was just great being able to talk on one recently and express it on my terms the way I went through it. And I sometimes I pinch myself because I feel like it's not real, and it is, and it feels great. And I've changed as a person, not only on the physician side of things. I've been a better father to my kids. I've been a better husband to my wife. I surprised my son at the bus stop because I can. I have a note that my son wrote to me, and he said, I wish you didn't have to work all the time, because I was dragging in 12 to 14 hour shifts out at Walmart trying to make it successful and not even seeing him before his bedtime. And I know we can all relate. I've been there. I think we all know the struggle is real. I think that we all hate the situation that we're put in, but we do it because we just feel like that's the only way. It's not the only way. I'm telling you my story, along with stories that you broadcasted and stories that the summit has talked about, and the list goes on. There are physicians in DPC that I admire still, and what they're able to do, vasectomies in the office, people who are in the rural family med clinics and seeming like they have 8 hands at the same time, being able to do what they do. I truly applaud, and I truly acknowledge and respect all of your capabilities. But now I want to be like them. I want to admire, and I want to grow as a physician personally and professionally so that I can be better at what I do. And I don't think we would have those opportunities in our prior roles. I don't think we were given the time or even considering the time to do it because it just wasn't in the equation. Now it is. And if a patient says, can you do it? I said, sure, we can try. And you don't have to be afraid. And they're not afraid of trying because they trust you and they love you and they believe in you. And so all of those things, you mold it together, and that's my DPC story, at least, but that's what hundreds of other DPC docs can say in their own words and agree with.
I love that. One of the things that I hope that people who are attending this summit, especially those who are family medicine physicians, I hope that they glean that the family medicine physician is still as valued as the family medicine physician today is as valued as the family physician was valued back in the 50s, back before we had HMOs. But in some ways, the family physician who chooses to do DPC is valued even more because we build that relationship with patients. And I feel that every day in my last 11 clinics at my fee-for-service job, I think about, if this patient were to come over to my practice, I literally could know them even more than I've known them for the past 5 years. And that is so amazing. And it makes me think about the idea of the scope of practice that we have. You're talking about these procedures that doctors do. But what I think about is another dear friend of mine in the DPC space is Dr. Amber Beckenhauer out in Blair and Ashland, Nebraska. And she said, if you need something, ask me first, and then we'll figure out if I can do it. And in most cases, the answer is yes. And she's a badass doctor. She still does her own delivery. She does her own C-sections, and she's got 4 kids at the same time and a husband who is her cheerleader. But man, when you think about, this is what I wanted to do in medical school, this is what I wanted to do in residency, and this is how I can do it in terms of being a full scope family physician, as much as that means to you, as well as being in this ridiculous community of, and when I say ridiculous, I mean that in the best way possible, this ridiculous community of people who are, how are you doing? I got your back. I feel that in general, there is support wherever you are in your DPC journey. And for you, this journey has led you to, again, having over 220 patients since October of 2020 in the middle of a pandemic.
Yeah, not bad. Right? Just like we planned. I know that fear was, and I think fear is the biggest factor that drives us away from DPC. I know it was for me. I think all of us are scared. I'm even scared at this point, even doing as well as I never imagined doing this close into opening. You always fear the fact that, are you doing the job well enough that patients would support continuing the membership? Are you reaching out to the patients when they need you, before they need you? Are you doing the best job you can? And every time I would tell myself I'm not, I just get more and more reminded by the patients who want to enroll that are new that you are doing your job, that patients are talking about you and they're saying great. And you start building more confidence. I look at other DPC websites and I listen to other DP stories that you've broadcasted. And I said, wow, I don't do that, or I don't do this. And I think some of us in this DPC network can agree to that. But what they don't necessarily do that you do is they don't bring the best version of yourself. You do. I'm a stand-up comic that does primary care, and I make people laugh, and we laugh together. And that ventriloquist that you see when you come in, the puppet that you see when you come in the office, is a replication of that. It is exactly what you said with our presentation this summit. If you've seen one DPC, you've seen one DPC. And the reason why is we are all unique to who we are and what we bring to the table. And I bring that special sauce, which is being a primary care that likes to have fun. And I think we all agree with that. I think most of us DPC docs have fun, and we definitely have fun when we see each other. But I think that's what fear, you should get grounded more by knowing that. Patients that come to see you in your existing fee-for-service clinic come to see you. That's it. They want to see you. And if you can spend another half an hour or 45 minutes with them, hell, they would want to even see you more than the first time they saw you, just because they would get to know you as a person and you get to know them as a person, and that relationship and that friendship becomes stronger. And you can do this. You have a community that has helped me, at least, with Josh and John Sanders and Brian Sanders, and the list just goes on. I mean, there's so many docs that I reached out with questions and concerns and doubts. And this community is so freaking awesome in that they really want you to succeed. They really want you to be a successful DPC. They really want you to continue to grow the DPC network, the community, the name, and continue to build networks. And I feel good. Now I have people asking me for advice, and I thought, this is awesome. Yeah, sure. I'll tell you what I do, and I'll tell you how I grew. And I'll always do that, because I want everybody to succeed, and I want everybody to be another stand-up family medicine, but call it whatever the hell you want, and make it grow based on what you feel is your call.
So when you mentioned that other people are even coming up to you now and asking you for advice and guidance, thinking in that space of the most common questions you get and the biggest things that helped you in terms of your daily organization, your ways to be personable with your patients when you're not seeing them in the clinic. What are your best tips that you would suggest others consider when they think about your practice, and to see if that would be a good fit for them, or if they could think in this space of an iteration of what you're doing that could work for other people as well?
Yeah. Initially, I knew nothing. And I started off with a DPC checklist that I downloaded from Atlas, and then also another provider, Beth Ruzili, I'm sorry if I mess it up. Beth gave me a checklist of her own that she had put together, and it was sort of my guidebook to what I needed to have, or at least arrange to have, prior to opening. Things fell in my lap. I read Doug Farago's book and sort of got a guidebook to starting DPC. And I remember reading it and looking into, it's never too early to start looking for office equipment kind of stuff, or something related to that. And so I put the book down and I went on Craigslist and I typed in medical exam chairs. And I was fortunate to find 2 medical exam chairs on sale, something like $500 or $600, and nice brighter ones that look brand new. And so I replied to the ad immediately, and the guy calls me and says, "Are you interested in the chairs?" And he said, "Are you interested in anything else?" And I said, "Actually, yeah, I'm planning on starting a direct primary care clinic, and it's a family medicine clinic, and yada, yada." And he said, "This is your lucky day. My wife is an internal medicine doctor for 10 years. And with COVID and everything, we've been forced to shut down because of her health not being the best and not wanting to risk anything further with it. And so I was fortunate to be able to buy a whole medical clinic minus the suite itself for $6,000. And that included everything from the AED machine to the EKG to 3 exam chairs to lab supplies to computers to you name it. It literally was everything that fills in my office today. I had no clinic to put it in. I didn't even have a location set. At that point, I didn't even have the damn name. But I had a dream, and I knew I needed this stuff. So I bought a storage unit. I took a U-Haul truck and put everything in the storage unit. Location-wise, I knew I wanted to buy a location because I didn't want to hassle with leases. I didn't feel good about the business leases in the COVID era and the long-term repercussions of what could happen later. And I just think there's something better about owning something versus leasing it. And my mother was fortunate enough to find something online. And usually she shows me these old decrepit homes with no roofs. And so I wasn't really eager when she had something to show me, but she actually found a location that was 10 minutes from my house. It was a Sunday afternoon. I was playing with my kids outside. I replied to the ad. The real estate agent called me back right away. She said, "There's 2 offers on the table. But if you want it, come today and I'll show it to you. And I can have an offer on the table the next day." And so I was lucky to come in and be able to snag the best offer and get that property. So literally one day, I came from no clinic to having an office location that was 10 minutes away. As far as building the practice, believe it or not, Walmart Health was a model that brought in a lot of patients that did not have insurance and did not have a good healthcare option. I did see patients, obviously, while I started there, and those patients had great experiences with me. And they were already paying a cash price to see me there. They were more than happy to pay a little more for a monthly membership and have unlimited use of me. And it really sold itself. Walmart Health was a business model that was similar to DPC, that it was price transparent, cost effective, and it was definitely reasonable as far as an expense goes for a patient, especially one with medical needs. So the word of mouth and the sort of broadcasting of what our clinic was about was easy, being in that Walmart Health world and doing something that was like it, but just not as good and not as cultured as stand-up family medicine was. Those patients found me. That helped generate some of the patient volume that I had. I always believe, and I definitely agree, that if you have a name in the community, you will grow faster because patients know you, and your name doesn't develop overnight. You build your success from your name and the way you practice, and that's how word of mouth gets along. Patients did start to find me when the word was back that I was in the neighborhood again. Things like Nextdoor was a great way of letting the local community in my neighborhoods know about it. Every patient that I knew that believed in me and knew who I was, and I knew that we already had a great relationship together, I asked them for a favor back. And I said, "Tell 5 people that you know about my practice." It could be a landscaper, it could be your housekeeper, it could be your best friend, it could be your babysitter, your daycare advisor. I don't care who it was. Tell 5 people about me and the practice and about what your experience was here. And even if one of them connect, then that one person is going to tell 5 of their friends because that's how they found out about you. And believe it or not, use your patients to your benefit. They are your best advocate. They know you. They've experienced you. They've experienced what direct primary care is and what it's done for them in their lives. And they're your best advertisement. And so that, believe it or not, quickly got the word out. And I think we always ask patients how they found out about us. And the most common answer is, so-and-so told me. We do obviously Instagram and Facebook pages. Andrea is very good about putting posts out there all the time about things from blueberry smoothie recipe to a snake that visited us in the office today to when the next stand-up act will be to you name it, And so we get the community engaged that way. And I think more people start to follow us, which is awesome. We have a local business perk. Andrea was smart enough to put some flyers on everybody's door just to say, hey, we're in this community now. And this is what we're about. I joined the office perk board early on when I started. I was able to just know who the other people in the office perk were. And I think that also gets my name out there too. And I just did that based on thinking, why not? This is a free resource I can use for my advantage. Business Network International, BNI groups. I didn't join a BNI group per se. I was very tempted to initially in the early stages, but I joined as a visitor to about 5 different networks that surrounded my office. And I was able to give a 30 to 45 seconds feel about the practice and what we were about. And I had gained some interest from a couple employers based on that. And even if it was just for 1 or 2 sign-ins, it was for free and I didn't break the bank doing it. We continue to think of other marketing resources, but I will definitely agree with the majority of DPC docs before me. Word of mouth is the key to becoming successful. And I'm letting it grow as it happens. I do pay about $300 a month for a web marketer / develop. He's the one who basically fixes the website here and there. It does the search engine optimization for me, AdWords for Google, etc. And that's really, I don't know essentially how much it truly brings to the practice, but it's not breaking the bank and it's something that seems to be working. And when it's broken, don't fix it. So I just let that ride until maybe something better or something more strategic comes along. But yeah, that's in a nutshell, that's essentially how it started and what I needed to do to get more patients in the door. And please understand, being yourself is what's up. Don't try too hard. Don't do something that you would not do or you'll regret. Just do what you feel is the right thing to do and do it because you love to do it. I've had situations where patients have tough financial situations and I look at them in the eye and I said, look, this month's on me because it's the right thing to do. And you can be empathetic, you can be human, you can care. And it shows that compassion. It might not come back from that patient. In my culture, I believe that karma and good things that you do will come back to you. And it has. I know patients that have just been so thankful for what we were able to provide them and have sent other patients our way because of it. Andrea, quick story, Andrea had wrote out to a radio station about a patient that was in need. She was a single mom of 2 kids. She was able to win a $300 gift card for the patient. And we loved just calling her up and saying, hey, we got something for you, and surprised her with it, as well as a membership that month for free. These kind of things, they hit home. They make you drive home with a smile. They make you hug your kids a little harder. They make you cheers with your colleagues even harder too. You just feel great about what you do. And it's not that necessarily that we expect something in return. We don't. We just love being ourselves and we love doing it the way we want to do it and not having any borders around how we do it. And that's why we continue to have great stories every day.
So inspiring. And on that note, Dr. Mehta, for those who are listening, what is the best way for others to reach out to you after this podcast?
My email, which is dr.mehta, MEHTA, at standupdpc.com. So dr.mehta at standupdpc.com. And the website is standupdpc.com.
Thank you so much, Dr. Mehta, for joining us today.
Thank you, Mariella. It's awesome. As always, you are the bomb and we love you. So keep your story and keep giving us entertainment for months and years ahead.
Next week, look forward to hearing from Dr. Marguerite Duane of Modern Mobile Medicine in Washington, D.C. If you like what you heard today, please leave a review and subscribe wherever you listen to your podcasts. Tell your friends too. For more information on this episode and much more, please visit mydpcstory.com. Also, for the latest in DPC news, check out dpcnews.com. Until next week, this is Marielle Conception.